This is Akashvani. In the program Spotlight, now we bring you a discussion on Ayushman Bhava, a comprehensive nationwide healthcare initiative. The participants are Dr. N.K. Arora, Chairman, National Technical Advisory Group on Immunization, and Aditi Tandon, journalist.
Inspired by the philosophy of Antodaya, which is the last mile saturation of health schemes, President Draupadi Murmu has today launched a very ambitious program called Ayushman Bhava. The objective of the program being to take the benefits of all existing health schemes right to the Gram Panchayat level, up to the district and the block level and the state level. The campaign will run from today until October 2, as we know, and the Seva Pakhwada under the campaign will start on September 17th, which will coincidentally also mark Prime Minister Narendra Modi's birthday. So, Dr. Arora, how do you see the vision of this campaign, considering this is the largest such community participation campaign after the cleanliness campaign, where we saw communities coming together to clean up their villages?
So, as a person from medical background, the most important thing of any public health program is that there should be 100% coverage. And the word you used was Antodaya. That means I must reach the last person. They are the most vulnerable, and therefore reaching them is a very high priority. And I think this is a real initiative which shows the importance given to the health of our people as a very high priority.
Dr. Arora, as we know that tuberculosis, sickle cell anemia will be high priority areas while the government engages people in Gram Panchayats, villages, block and state and district level. I wanted to understand from you the broad structure of the program as elaborated by Union Health Minister Mansukh Mandaviya yesterday, is that it will be an umbrella campaign under which three different pillars will be rolled out. The first pillar, of course, will be Ayushman Aapke Dwar, under which the remaining unenrolled beneficiaries of the Pradhan Mantri Jan Arogya Yojana will be brought into the system, about 60,000 of them. Then there's a plan to have weekend level campaigns and outreaches at the health and wellness centers, where villagers can actually come and get screenings, get teleconsultations, doctors will be there, nurses will be there. And the third and the final thing is to hold Ayushman Sabhas at village levels where you disseminate health information. Which are the key areas of health outreach you think can be best achieved through this kind of a community outreach?
Most of the public health programs are targeted at the vulnerable population and to ensure that there is not only health, that means disease-free status, but wellness, that this whole concept of wellness has been brought into our philosophy. Now, when we talk about tuberculosis and sickle cell anemia, tuberculosis is a flagship program. In fact, our Prime Minister has committed that by 2025, we should try and eliminate this disease. And the kind of community engagement which has occurred through Nikshay Mitra Karikram, where the community members, NGOs, institutions, corporate sectors have adopted patients, and they ensure that they take their medicine on one side, but simultaneously provide them food supplement in a monthly manner. Now, this is a great example that how community engagement can catalyze and push the reach of the program and also the acceptance of the program. And tuberculosis program is a very good example in that. On the second side, when I see sickle cell anemia, again, the primary target is our tribal population. There is a strip across the central India, and there are almost 7 crore tribal population is there, which have to be reached. And because the sickle cell anemia is a genetic disorder, hereditary disorder, and our tribal population suffers maximum from them. So there is not only a systematic program to reach up to that, because tribal health by itself has many unique features. So again, reaching up to community, and as you said, Ayushman Aapke Dware, that this paradigm of reaching up to the community's house is an important concept, and that is why we were able to eradicate polio. We are able to reach up to every child for eradicating measles, and the same way sickle cell will also require, there is a program so that there is a screening for this disease. Those who require treatment, they are treated, and those who are carriers of the disease, that genetically at risk, they will be counseled so that the marriages don't take place between the at-risk population. So these are both very ambitious programs, and community engagement is absolutely critical in this. And the way Ayushman Bhav Karikram has been conceptualized, it again shows that the importance of community in participating in their own health and well-being.
Dr. Arora, in the Seva Pakhwada, which has been drafted as part of this very important campaign, it has been decided that a special drive will be launched also to encourage people to donate organs and make pledges to that direction. Besides that, there will be blood donation camps. Every blood bank in the country has been approached to hold at least one blood bank camp. So there's a larger goal of giving back to the community. I wanted to bring you in on the issue of organ donation, considering the government has been very active in creating awareness around this. An online organ donation pledge registry has also been created for the Seva Pakhwada, with the toll-free helpline number being 1800114770. But overall, Dr. Arora, there seems to be still a hesitation at the cultural level in the society to donate and pledge organs.
You have raised I would say, a very emotional issue. And again, the commitment of the policymakers, the government on this issue of organ transplant has been lingering on for a long time. And all of us are so pleased that it has been taken up because, as you rightly said, there are cultural barriers. People, when we leave this world, a lot of our organs can be used. But it is not only that. See, chronic kidney disease is wide, and similarly liver issues, chronic liver disease and liver failure. And there is estimates that several thousand organs every year are required because now we have the medical technology and expertise, and people can donate organs to their near and dear ones. So that is the second dimension. And the third dimension you talked about is the blood donation component. So unless we bring about a paradigm shift in the community thinking that organ donation or blood donation is the highest form of donation, and it is only through these community campaigns that we can break through some of the barriers, cultural barriers, and even I would say mental attitude that needs to change. So a kind of a cultural revolution is required in our communities, and only through such campaigns that we can bring about. It's a slow process, but the way it has started, I'm sure it will start having a dent on our thinking process.
Since the Seva Pakhwada aims to actually encourage people to seek health services, because a lot of times we've seen, Dr. Arora, health-seeking behavior itself becomes a challenge, especially when we talk about females in rural India. So this objective of going right to the village is a very welcome objective. Also, don't you think this occasion can also be used to create awareness and send out outreaches with respect to mental health services? Because in the aftermath of COVID-19, Dr. Arora, one has seen that the mental health epidemic has really gripped both cities as well as villages, and these barriers have really collapsed.
Aditi, you have raised two issues and challenges. One is care seeking, and we have done studies ourselves that care seeking for both children and women is delayed, particularly. So a lot of newborns and young infants die at home because the parents are not able to identify danger signals. Similarly, women, they get really sick, they will keep on denying and do not seek care. While now we know that our primary health centers, community health centers have started functioning much better. And these are quite close of our houses. I mean, the community access is no longer such a big issue. In addition, under National Health Mission, now drugs are also easily available. So there is a need to create awareness that the next door dispensary or a primary health center or a community health center should be approached, because you will not only be seen by a trained professional, but also you will get the desired medicine, whatever is required. Because many of us have this feeling that things are not available. So what is the point of seeking care? And they would rather seek care from an unqualified person or from private circle, even in our rural areas, even among poor people. So I think this awareness is very necessary. And again, this Pakhwara should focus. And I think this is a major paradigm shift in the way people start thinking, and their trust in government health system should improve. The second point, actually, again, mental health issue. And I'm sure you are aware that as part of health and wellness centers, one of the tasks they have been assigned to also provide mental health services. I do not know how many of us are aware that almost 10% of individuals, adults, have mental health problems like anxiety, depression. And this has, in fact, very prominent, as you rightly said, during COVID and post-COVID. And another dimension is that adolescent, our young individuals between 10 years and 20 years, in fact, these problems are even more prominently coming up because of the stress they are undergoing, whether it's job related, family related. So government is making all out effort that even at health and wellness centers, mental health issues can be taken care of. And I'm also telling you that there is a lot of research going on, and we call it implementation research, that how to make health and wellness centers epicenter of health services in our country as a next door service which is available within few walking distance. And mental health, cardiovascular disease, chronic disease, besides infection, they will be provided. And you also raised another very important point was the telemedicine. And there is a real effort going on that these telemedicine services, a network is formed where district becomes the first hub where a consultation can be there. And when required, they can be linked to a medical school also.
Dr. Arora, there's one more component of the Ayushman Bhava campaign, which says that the idea will be to create what is called healthy villages and healthy gram panchayats, with a larger objective of reaching universal health care across the country. And panchayats that have successfully saturated the delivery of health services up to 100% will start getting rewards in the form of Ayushman Gram Panchayat in the villages and Ayushman Urban Ward in the urban city areas. How much impact do you think this kind of competitive edge in the delivery of healthcare services can make really on the ground as far as reaching saturation is concerned?
There are now global examples of this kind of approach where a healthy competition between villages and mohallas are created so that health services are utilized, and as you rightly use the word saturation, so that every individual who requires these services, health and wellness services, and Nepal is our immediate neighbor, they have used this strategy for immunization. So when a village gets 100% immunization coverage in children, these village councils are awarded. And as a result, their immunization coverage improved. I think this is a very welcome step that we bring about this competition. And it is not only competition, it is a way of social accountability, because panchayats then becomes accountable and responsible for the people they are representing. And they ensure that every individual gets the appropriate care at the right time. And I would strongly wish that this is taken up in a real mission mode so that these local self-governments become a kind of a harbinger of spreading awareness as well as ensuring health and wellness for every individual in their villages or mohallas.
Thank you, Dr. Arora, for your elucidation on the subject.
Thank you very much.
You were listening to a discussion on Ayushman Bhava, a comprehensive nationwide healthcare initiative. The participants were Dr. N.K. Arora, Chairman, National Technical Advisory Group on Immunization, and Aditi Tandon, journalist. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app, News on Air. This program is also available on our YouTube channel, News on Air Official. You may share your feedback about this program through email at airnsttalks@gmail.com or WhatsApp on 928 909 4044.